Hi, my name is Dan, and today I'm going to be talking about exercise for the treatment of depression. I've sat in hundreds, maybe even thousands of psychiatric interviews over my career, and exercise is sometimes an afterthought. There's so many other topics that are discussed with the patient, and then maybe a few line or two is how much do you exercise, what kind of physical activity do you do, but it's not a focal point of a part of a psychiatric interview. And psychiatric units don't always have great places for the patients to exercise, anyways. I worked on one inpatient adult unit that had either a treadmill or an elliptical, I can't remember, which probably says something to how often it was used, but it was in a locked room and the patients had to have a nurse there watching them if they were using it. So it would take one nurse's entire time to be with just one patient. So it was difficult to use. Patients didn't use it all that often. When I worked on child and adolescent inpatient psychiatry, they did it a little bit better there. So the hospital that I worked at had an entire basketball court and gymnasium inside the hospital, and it was used as kind of like a reward system. So the kids that were doing well enough and behaving well enough to be given off the unit privileges were able to go to the gym and play basketball and run around and just be kids. And I think that can be very therapeutic. I think one of the ways that we can increase how often depression is treated with exercise is to put a number to how effective exercise can be. So what I try to compare it to is to imagine if an antidepressant was released that could be used alone or added to other antidepressant medications that decreased depression scores by 3 to 6 points and had virtually no side effects. A medication like that would be $1 billion drug. Every patient with depression would be on it. And that's what exercise can do. It can be used alone, it can be added on to antidepressant medications, and it's going to decrease depression scores by 3 to 6 points. The tougher part of the sell is that you have to take the time and the energy to exercise, which is different than just taking a pill. So I understand that difference there. How does exercise work for depression? What's the potential mechanism? There's a few theories out there, there's a few different studies, but there isn't a pinpoint finalized answer yet. One of the theories is called the thermogenic hypothesis. So this hypothesis states that increasing your body's temperature and therefore increasing your brainstem's temperature is associated with relaxation, muscle stress and muscle tension relaxation, and overall relaxation. So that's one potential mechanism. The second is called the endorphin hypothesis. So endorphins are natural chemicals that the body releases. Endorphins are associated with runner's high, if you've ever heard of that term. So runners, after they're exerting themselves, after a while just feel like really, really euphoric and really good. So endorphins can have that positive effect on mood. And then the final potential mechanism is the monoamine hypothesis. So monoamines are chemicals like serotonin, norepinephrine, and dopamine. These are the chemicals that a lot of the antidepressant medications work on. And exercise has shown to increase monoamine levels in the plasma and the urine. So after exercising, those levels have been shown to increase in the plasma and urine. That doesn't necessarily translate to levels in the brain, but it could be correlated. It isn't all just theory, though. There are trials that show exercise's benefit on depression. So I was looking at, there's so many different trials that I found a few meta-analysis. So a meta-analysis is when a trial takes a bunch of previous trials and combines them. So it's a lot easier to read rather than reading all the individual trials to read the bulk meta-analysis. So one meta-analysis that I looked at had almost 1,500 patients, and they were split to either exercise or not exercise. And they had depression. And the group that exercised, their Beck Depression Inventory, which is a depression scale, decreased by 6.46 points. So that's clinically significant, that's statistically significant, and that's really beneficial for people's mood. A second meta-analysis that I looked at was a meta-analysis of 10 trials, and it showed an average decrease of 3.49 points on the Hamilton Depression Score. So this is where I got that range of like 3 to 6 points depending on type of exercise, depending on which depression scale is used, because they all have different ranges. But regardless of the scale used, and type of exercise too, so resistance and aerobic exercise have both shown to decrease depression scores. So putting those numbers to it can sometimes be helpful to convince people to try to exercise for the treatment of depression. So my personal experience with exercising and assessing my mood is that I definitely feel an increase in my mood after I exercise. So I exercise in the morning before work, so I feel rough when I'm getting up at like 5:30, 6 in the morning. It doesn't feel great at that time period, but then as I'm going to the gym, and what I normally do is resistance, so like weight training, other resistance exercises for about 30, 45, at the longest an hour, and I normally try to do it 3 or 4 times a week, and I've noticed such better improvements in my mood on the days that I do go to the gym. My work day seems better. I feel like I'm nicer at work. I feel like I'm nicer throughout the day. I feel like my stress level's down. I'm more relaxed. So as compared to the days where I sometimes feel like, I'm gonna sleep in today, and I don't go to the gym, and then I notice I'm more on edge and more stressed. So I definitely personally see the benefit that exercise can have on mood. So I hope this review of the potential mechanisms, looking at some of the meta-analysis, and my own personal experience was helpful in explaining how exercise can be helpful in the treatment of depression. Thank you for listening.